We will start the session working on the patient's feet. Always at the beginning, it's a good idea to allocate a towel to clean any residue that is on the soles of the feet. And then place them on a small pillow that gives us space to be able to place the bowls on the feet. The important thing is to always seek stability when positioning the bowls. We do not want the bowls to fall while we are working, so we can help ourselves with towels or cloth to hold our instruments. We will start working on the dominant foot, which we can consult with the patient in a short previous interview. In the case that the patient is right-handed, we will start with the right foot. We make sure that the feet are not touching the floor and that our hands do not make contact with the patient's foot, but simply that the base of the bowl is in contact with the base of the foot. We are looking for a comfortable position in which we can allocate between 2 and 2.5 minutes. In this case, the right foot first. 2 to 2.5 minutes is recommended for each of the positions that we are going to work on in this course. Always when hitting the bowls, keep in mind that the next hit has to happen before the vibration ends. We do not want the vibration to turn off completely in the bowls. So depending on your instrument, feel that both the sound and the vibration are constant at the moment that the bowls are positioned on the patient's body. The only time when the bowls turn off is when we change the position. Once the dominant foot is finished, we move to the second foot. We are always going to start the session working with the patient face down, that is, on her back. Spiritually and psychologically, working on the back means that we are relating to the patient's past, to their history. And we want to make sure that before going to the front, which symbolizes the present, that we have already aligned the past. By working on the back, we work with the past emotions and with everything that the patient brought with her to the session. After working on the past, we hope to resolve what the patient brought with her to the session. Again, on the second foot, we will spend about 2.5 minutes. We will use the universal size bowl, whose diameter is around 20 to 21 centimeters. Once each individual foot is finished, we propose to bring the patient's feet together and work both feet simultaneously. As therapists, it is important not to judge the patient and not to bring our emotions into the session. Let's just be a vehicle to provide. Prior to the session, we can offer a glass of water. It is always important that the patient is hydrated before starting our therapy. It is important to give with compassion. The space that we create is the most important, where the patient can feel as comfortable as possible. Once the work on the feet is finished, we proceed to move the pillow from the place. In this case, we are going to position it a little further up on the patient's calves. The feet are going to be a little bit in the air, slightly dangling. We do not want the feet to be in contact with the floor. We place a long-sized towel on the patient's back, and with our hand, we make contact with the central chakra. What we want to feel is where the patient's ribs are positioned to position our bowl a little lower. That is the right place for the third chakra, the solar plexus chakra. The solar plexus chakra, which is called Manipura chakra in Sanskrit, has as its basic principle the shaping of our being. Its associated element is fire, and its associated sense is sight. It represents our sun, our center of power. It is the part of the body that radiates our emotional energy. Peace, inner harmony, acceptance, and fulfillment are centered in the Manipura chakra. We will start working on the back on chakra number 3, again with a universal bowl of 20 to 21 centimeters in diameter. Once we hit the bowl, we want to build energy around the patient. So we will strike it and start to walk clockwise. To find more stability in the bowl, we can also place a small towel on the chakra. It is always good to take our time and give the bowl the possibility to vibrate without letting it stop, but without rushing. Ideally, we will hit the bowl from the back to the front, aiming for the bowl to direct its energy upwards. Once the solar plexus chakra is finished, we can add another towel and go to the sacral chakra. The sacral chakra, or the Swadhisthana chakra in Sanskrit, has as its basic principle the creative reproduction of our being. Its associated element is water, and its associated sense is taste. It is our unfiltered center of primordial emotions, sexual energies, and creativity. This chakra is where our being is established. Here is centered sense of self, pleasure, relationships, and creativity. Chakra number 2, the Swadhisthana chakra, is more related to earthly aspects. In these positions, we want to use bigger bowls because we need more weight to work on the chakras that connect us directly with the earth. In this case, we can use a larger bowl of around 25 to 26 centimeters. Again, we will work from 2 to 2.5 minutes, and we will continue hitting the bowls from the back to the front. As therapists, we do not need to protect ourselves, but we need to commit ourselves to this patient and, in this case, become one with their energy. Observe the unified field. The calmer our emotion, the calmer we are going to transmit. We do not have to seek to be perfect in the treatment, but to be willing to provide comfort and to provide a good experience. Once chakra number 2 is finished, we will go to the first chakra, the root chakra, associated to the color red. In this case, we use towels on the legs to be able to hold the bowl, always looking for a way to position the bowl safely. In this position, the bowl is again the heaviest, around 25 to 26 centimeters. In our case, we are using a bowl with a weight of around 1 to 1.5 kilos. The bigger the bowl, the slower its vibration will be, and the more low frequency its sound has. These low frequencies are closer to the earthly chakras. When working in the lower chakras, we will always look for a low sound and a slow vibration from a bowl that has weight. The root chakra, known as the Muladhara chakra in Sanskrit, has as its basic principle the physical will of the being. Its associated scent is smell, and its associated element is the earth. It gives us earthly stability and solid ground. Here, we are associated with Mother Earth, stability, self expression, and primordial trust.